Hello, my name is Yunso Song. Did you know that artificial intelligence has been used in the healthcare field for many years? It is no longer a faraway future that everyone has imagined. My research question is, how has AI been used to save lives during the COVID-19 pandemic? This presentation will elaborate on how AI has helped society during the pandemic in chronological order. I will first cover what is AI to define what AI is. This part will help people understand how AI basically works and how it has been used in the field of healthcare before the pandemic. Second, I will further explain how AI helped us treat and identify COVID-19. Identification was an important process at first so people could form the right treatment and prevention for the virus. Third, I will talk about how AI helped people prevent the spread of disease. People have put in the act of wearing masks to prevent themselves from being infected or spreading the disease. It will specifically mention how AI has worked as a mask for people. Lastly, I will elaborate on how AI helped us develop a vaccine. With the help of AI, the process of making vaccines could be accelerated. Before we jump into how exactly AI helped us in the pandemic, I will first define what AI is. As many of you may know, AI stands for artificial intelligence. The Oxford Dictionary defines AI as the theory and development of computer systems that can perform tasks that normally require human intelligence. It is used in various parts of our lives. The closest AI to you now may be your smartphones. We all have our phones. Smartphones act as your personal assistant and tell you the weather, call someone, and sometimes it functions as remote controllers for your home. Further on, it is used in self-driving cars. They sense what is around them and decide whether they need to lower the speed, start driving, move straight, or turn around. Through the programmed AI, machines get to work efficiently, solve problems, and analyze fast data. All of its job is very much needed in everything that the machines or robots do. Well, it does a good job of solving problems and analyzing data. Now you may be wondering how it works. Data, processing, outcomes, assessments, and adjustments are the 5 major steps in processing AI. AI functions with a combination of vast amounts of data with quick and intelligent algorithms. The stored data makes processing fast with high accuracy. When the data is done processing through the algorithms, it decides whether it is a success or a failure. Depending on the outcomes, the AI moves on to the next process, assessments. In this process, it goes through analysis, discovery, and feedback. According to the results of an assessment, finally it adjusts data and rules to target the outcome. This may be so much information to understand, so I would like to provide an example. When we are trying to solve a math problem, we learn the basics and the theory to solve the problem. The theory and the basics act as data in AI. Processing is when we try to solve a problem by applying the theories we have learned. Outcomes are the answer that we get when we have solved the problem. We assess whether the answer is right or wrong by trying to solve the problem again or looking at the answers. If we get the wrong answer, we have to adjust the information we have received or the process we have gone through to solve the problem. Before I move on to my research topic, I will lastly talk about how AI has been used in healthcare so far. AI was able to be used in the COVID-19 because it was already being used in various illnesses, especially in diagnosis and clinical trials. First, in diagnosing disease, AI predicted and diagnosed illnesses. The diagnosis was faster than professionals, and the results were even more accurate. It even analyzed the prognosis of the disease. With the acknowledgement it has received so far, more and more companies like PassAI, Procia, and Page AI are developing a diagnosing AI. Second, it has helped boost in clinical trials. It enabled a continuous stream of clinical trial data. They utilize medical images to determine the appropriate patients. By collecting the various information and analyzing it, AI was able to boost in clinical trials. Now, AI Cure and Brit Health are working on this AI to help more people. So far, I've covered the basics of AI and every background information needed for you to move on to the following presentation. To begin a story of how AI helped people during the COVID-19, my first question is, how did AI help us treat and identify COVID-19? This process is needed for every single virus that has suddenly appeared. Without any data on the virus, it is unimaginable to come up with a treatment, vaccination, and prevention. When everyone was in a panic about the new virus, an identification process was seriously needed. The identification measure is a process of identifying the disease. It is done by experts and scientists, but it requires costly materials and it can take a long time to arrive at the answer. It would be great if we could take this much time. However, the society was too urgent. During this process, technology can accelerate the procedure and reduce the cost of identification and effort of the experts' research. Modeling application was often used to understand the transmission of the virus. There are various ways to detect the coronavirus. We often use the PCR test or the antigen test to detect the disease. We also use chest CT scans to find the infected parts in our chest to determine whether we are infected or not. An artificial intelligence-based platform has been devised which utilizes a neural network to evaluate X-ray images and automatically detect the COVID-19 virus infected positive specimens with an accuracy of 97.82%. Harnessing advances in computer science for medical diagnostics may serve as an essential tool to standardize and speed up the testing process. It is being developed by various companies. Not only chest scans but also Remap, a randomized embedded multifactorial adaptive platform, are being used to find the right treatment for a disease. The University of Pittsburgh Medical Center is implementing an innovative design using AI to rapidly assess which medical management plans are working most efficiently and safely to treat patients positive for COVID-19. First, it tests multiple new therapies, as well as therapies currently in use in a short amount of time. This platform works using reinforcement learning. It identifies the therapies with higher success and can assign those therapies frequently. UPMC uses an electronic medical record which provides a subject pool for the trials. By the records they have received, they will be able to aid severe COVID-19 patients with beneficial treatment and therapy. No one had expected the COVID-19 pandemic, and people were making urgent treatments and identification to prevent the spread of the disease. Although several people worked to prevent the spread, humans were not enough to cover various fields. AI was needed. Its fast and accurate processing was needed to prevent the spread efficiently. So, how did AI help people prevent the spread of disease? Contact tracing is the process of identifying, assessing, and managing people who have been exposed to an infectious disease to prevent the spread of the infection. If someone had contacted the patient, they would have started self-quarantine. Experts have pointed out that detecting and controlling the spread of COVID-19 are important in managing its cases. GSM cell, Wi-Fi, GPS, and Bluetooth are the 4 contact tracing technologies that can be used to obtain a network of contacts. Every mobile phone has a registered cell, and whenever it is in any new cell, it can also be identified. Telecom providers can determine the location of every mobile phone in their network. Every device in a local communication network like Wi-Fi is identified by its physical address, so the MAC address can help in contact tracing. Every smartphone has a GPS app that allows for location tracing. By using these technologies, experts get to trace the disease efficiently. Facial recognition AI is also being used to prevent the spread. You may be wondering why this helps prevent the disease. The facial recognition AI is very close to you. You may use it as a method of unlocking your phones. You may have gone through a hard time unlocking your phone outside during the pandemic. You need to wear a mask to prevent the spread of the disease, and that mask covers 50% of your face. This made the AI confused, so the facial recognition AI could not recognize your face and wouldn't have unlocked your phone. What if we use this idea in an opposite way? What if we program the AI to determine whether the person is wearing a mask or not? It is easy if we program it in an opposite way. If the program can't read the person's nose and mouth, it is likely that the person is wearing a mask. The verifying process takes less than 1 second with 99.9% accuracy. Before the pandemic, the accuracy was 20 to 50%. It has been improved tremendously during the pandemic by companies like ML6, NEC, and more. Smart wireless biosensors are being used. This biosensor was developed by Northwestern University and Shirley Ryan Ability Lab in Chicago. It basically checks the onset and progression of coronavirus infection by picking coughing, breathing rate, heartbeat, and body temperature. It is a band-aid-like patch placed at the midpoint of the neck and the chest. To use this biosensor, first you need to measure the mechanical vibration of the skin as a person coughs or breathes. Second, the person needs to manually remove the patch and place it on the charger. When it is attached to the charger, it syncs its data to an iPad, which then uploads the data to the cloud of AI algorithm examination for COVID-19 presence. By detecting the disease early, people could prevent the spread with a better result. Finally, I found a robot that helped prevent infection between patients and doctors in the hospital. There are many things that the robot can do to help the patients and prevent the infection. The company, Milagro Robots, was seeing the situation in Italy where almost 30% of the healthcare workers were getting infected. The company got a call from India's largest medical hospital. They decided to work together to solve this problem. During the process, Robot Dr. Elf was selected. They can serve as telepresence for the doctors. By connecting the doctors and the patients by robot, the patients and the doctors could minimize contact, which is safe for both of them. It has a lot of capabilities in terms of dancing, singing, showing movies, and more. At first, the patients are worried about whether they could get the right treatment because they are not used to non-human doctors. However, they get accustomed quickly and enjoy the treatments they receive. Finally, how did AI help us develop a vaccine? This question is very significant because the vaccine soothes the pandemic. Now we don't have to wear our masks except for some places. AI was used to make a novel molecule transformer drug target interaction model. This model was suggested to address the need for an antiviral drug that can cure the COVID-19 virus. By this model, it was discovered that the best treatment for COVID-19 was a common antiretroviral medication used to treat HIV. In combination with the docking application, the use of machine software was more effective in forecasting the reusability of an existing old COVID-19 medication and greatly decreasing the amount of a risk factor and creating a more cost-effective drug operation. The use of machine learning and AI improved the drug production process by reducing the time slot for the courier to explore an alternative therapy and remedy. However, this method had concerns and problems with the finite resources of stable hybrid data and real-life deployment of the programs. This is not a specific AI that has been used, but the process of inventing a vaccine by using the AI. First, it analyzes the available data on COVID-19. Through this process, AI picks out information or data that is useful in drug or vaccine delivery design and development. It speeds up drug testing in real time. This helps to accelerate the process of vaccine development. Finally, it identifies useful drugs and suitable vaccination for the virus. AI supported the development by its fundamental use. AI has helped to identify the COVID-19, determine the disease by chest CT scans, and finally, treat the patients efficiently with remap. Second, AI has helped prevent the spread of disease through contact tracing technologies, facial recognition programs, smart wireless biosensors, and Robot Dr. Elf. The vaccine development was supported by the novel molecule transformer drug target interaction model and the development of drugs and vaccines. AI has helped so much for the past 2 years of this pandemic. It has improved tremendously and people realize the significance of the AI over the 2 years. I believe that we can prevent future pandemics with the AI we have used for the COVID-19. Thank you so much for your undivided attention.